Boosterhausen works with. You're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. Well, welcome back, everybody, to Age Management and Peptides with Dr. Kris. And this is our weekly show where we get to talk about all things in proactive health management, a way to take control. Dr. Kris has become the voice of the folks. We don't want to just go to the doctor and the doctor says, just keep doing what you're doing. We'd like to know a little more. We'd like to take control. And so, Dr. Kris, how are you?
I'm good. Having a really good week. How about yourself?
Excellent. So, Dr. Kris is with the Research Clinic, and these conversations are intended as educational, and you should always consult your physician before changing your medical program. So, Dr. Kris, we have a surprise guest.
We do. So this is Lorinda Van Newkirk. Many of my patients probably already know her. As I was telling you off the air, Steve, Lorinda and I and her husband and my wife have been friends for many, many years. Our kids have grown up together. Lorinda has a very interesting background that I think she could probably give us a little bit of a glimpse into. But I think Lorinda has, woke up here recently and decided that she really, really likes some of the things about aesthetic medicine and has been really enthused, and she's been part of our practice now for a few months. She's doing great things, and I'll let her kind of just introduce herself from there.
Thanks, Dr. Kris. I'm Lorinda Van Newkirk, and like Dr. Kris said, we've been longtime friends, and I've also been a patient of his for a long time also, I guess I could say. But I actually did come probably about exactly a year ago to the date, pretty much. I came and met with him and told him I was thinking about totally kind of having a whole career path. I've been in the wholesale, retail, manufacturing end of fashion the last 20 years. And 20 years ago, I kind of started this, well, probably longer than 20 years ago, I started this journey, and it's just funny how you'll come full circle again. But I came and met with him and told him kind of my plan, and he said, okay, sounds good. Just let me know when you're ready. So
you're ready. So Lorinda, tell us what specifically you're going to be supporting Dr. Kris and his clients with.
So I'm going to be on the aesthetic side. And what I'm really focusing on right now is just skincare. Just really educating our patients on having a great skincare program at home and what that looks like, and teaching them what great skin feels and looks like. I'm doing a lot of Hydrafacials, microchanneling, which a lot of people have heard of, I'm sure, microneedling. But we do microchanneling here, and it's pretty amazing. The downtime compared to microchanneling is amazing. So we're doing a lot of that.
So Dr. Kris, explain to me, I'm a guy, so maybe microchanneling, I'm not sure exactly what it is, but tell us some of the things that you guys offer at the research clinic along these ways.
So with the microchanneling or microneedling, any of those type processes, you're making little tiny breaks in the skin to actually allow things to penetrate through the skin, under the skin. And it sounds like a barbaric procedure. It's really not. It's fairly painless. But you're just getting, it was kind of made popular by the Kardashians a few years ago. People have heard the name of like vampire facelift and things like that, although we have to be careful with that term. And so, you can get extreme skin tightening, collagen repair from these type procedures. So basically just more youthful skin. I always like to tell patients, it's kind of like we go back to fitness, or wellness. Exercise and nutrition are like the most important parts. When it comes to the skin, so many patients don't really do anything for their skin. I think Lorinda could back me up on this. I'm always blown away by how many people have no skincare regimen whatsoever. And even women, like I kind of expect it from guys. I think that's fairly normal. It kind of goes back to what I always joke about with guys who I always say, well, we could try to do testosterone via a cream or a gel. And I go, but how many times as a guy have you ever put lotion on your body? And they're like, never. And so it's kind of the same thing. Like, how often do you put lotion on your face? How often do you wash your face with a good and quality skincare product? And most of the time, most guys are using whatever their wife bought, which is typically like a, what is that stuff called? Like Axe wash.
Wash your hair and your face.
Yeah. Something that you can wash your hair, your face, and your body with. Like that doesn't sound appropriate to me. And you don't ever want anything that's highly perfumed as well, because it really dries the skin out. But then I'm really blown away by how many women don't have a skincare program, or if they do, they're actually spending a lot of money on bad products. They go to the department store and they mean well. They just don't realize that, those aren't always the most quality products. And so, the good news is today is that the quality skincare products are not as unaffordable as they used to be. And the other thing that's always important for patients to understand with quality skincare products, a little goes a long way. So smaller bottles last a lot longer. And that's something we have to coach our patients through. Like, oh, the bottle looks kind of small. Like, oh, but that's going to last you a couple months, And so, but protecting the skin from the UV rays, like I always tell my patients, I want you to feel good. I want you to be 55 and feel 35. I also want you to be 55 and not look 75 with your skin. And so anyway, but microchanneling, microneedling, the Hydrafacials, which is the best facial machine on the market. It can't even be debated.
No.
It just is. I looked at all different kind of brands, but Hydrafacial is just simply the Rolls Royce of facial, machines. Of course, that also Lorinda's not going to be doing this part, but that backs up into me with the Botox and the fillers and things of that nature as well.
Well, and it's so important if you're coming in, and you're getting filler and you're getting Botox and you're investing already in your face, and then you're not doing an at-home program, it's kind of like your scale is going the wrong way here. So if you're prepping your skin and you're preparing it for all these things that we can do here with filler, Botox, the Icon, the 3&Me, microchanneling, you're giving your skin preparation and a base to actually do what we're asking it to do. So if you're investing already in your face, you need to take it, the full gamut.
Really, I think the theory behind skincare is no different than the theory behind like hormone replacement. You're prepping the body with exercise and nutrition, and you're kind of topping it off with the hormones. I think it's the same way with skincare. You're doing all those things at home that maybe, some of our patients who do want to do some of the more aesthetic procedures like injections and things like that. You want to get the most bang for your buck, and you got to have a maintenance program to do that. Otherwise, I just don't think most patients are ever completely satisfied with the results.
No, I had a patient the other day that's had lots of different surgeries done to her face, and I was giving her a Hydrafacial, and through our conversation, I kept kind of trying to figure out what the issue was and what she was unhappy with. And then by the end of the Hydrafacial, she had admitted to me that she never washes her face at night. So, you know, you start figuring out, okay, we can do lots of things, but if you can't, you know, do a little at-home care, you know, sometimes we can't do everything.
We can't do everything for you.
No.
Well, there's some foundational things. So all the conversations that we have on this program, we're talking about some basics that are always in play. Your diet, your rest, your vitamins, your exercise. These improve your skin health as well. What are some of the fundamentals, the foundational things that everyone should be doing right away? And then let's talk about the things that you guys can offer to supplement that.
You want me?
Yeah, I'll let you take that.
Yeah.
That's your field. I'll let you take it.
Okay, so just things you should be doing at home with your skincare, washing it every day. The number one thing, you know, I really try when I meet with my patients, I want to know, what is your lifestyle? What do you do? What's your activities? How busy are you? I don't want you to come into me and I line up 7 products for you. You know, if you're a 3-product person, let's get you started on a 3-product, and then you decide, or we decide, we grow from there, or you stay on 3 products. But just, you know, cleansing the skin and getting some great foundation, you know, with moisturizer. And the number one thing is, please wear sunscreen. Please, you know, wear sunscreen. And we are in Weatherford, Texas, and we have a ton of women or men, you know, that they're out in the sun. A lot of them have horses. So, you know, we're dealing with that lifestyle and being out in the weather of the Texas heat. So we, you know, there's different things we have to do and cater, especially different times of year. We have to change up your products, you know, to Texas heat, to Texas winters. So, you know, we have to kind of guide and move along from there. But, you know, just little bit of effort can go a long way if you're already coming here and getting other procedures done.
So let's talk about what are the rituals that one could just kind of work in and start making these habit things that would really help get us past forgetting to do it, not doing it, being lazy. That's me.
Well, what's great about the skincare line that we carry here, the ZO skincare line, which is only sold with physicians, which I love because it's such a great product, and it's just not, you know, on Amazon or anywhere. It's a great company. They stand behind everything they make and produce, the science behind it. Great support to us. But what makes it so great, you know, they have a great cleanser, and it's simple. You're either an exfoliating cleanser, a gentle cleanser, or hydrating cleanser. So we don't have to get crazy there. We have this polishing scrub that not one person, that they're addicted to it. When you put that on your skin and when you feel how your skin feels after that comes off, it's amazing. And then of course you do a little toner that keeps the pH balance in your skin, gets it dialed in perfect, and just some hydration. So I just recommend people put that on. It's pretty, especially for women. It's all pretty. Just leave it on your counter, 1, 2, 3, 4, maybe. And you don't have to do that many if you don't want to. And it's just, you're going to see results immediately. So that's what's so great about this product. Or, you know, even, you know, doing a ritual at home, you're seeing results. And I love, you know, asking women, you know, in the last year, what's the, like, if you had to give me a percentage, how much better is your skin from your product? And most of them are like, you know, 5, 10%. And I'm like, well, then why are we still using this product? Let's turn it up. Let's give you some results, because nothing is expensive or nothing is out of line if it's giving you results and you're feeling great.
If I could give a little bit of input as a guy, because I'm no different than any other man when it comes to using products like this on my skin. And I still probably should be using more, but I just I typically will buy multiple versions of the size. Like we have a travel version and then like the normal version. And so I keep it in my shower. Mm-hmm. So it's just there with my shampoo, my soap, there's my face wash, there's my scrub. And, you know, even though I'm a doctor, I'm no different. I basically, these ladies sat me down and said, here's what you need to do. Here's your ritual. For me, it's 1, 2, 3. 3 is typically kind of the cutoff for men most of the time. It's no different than supplements, like the discussion we always have with supplements. Like, how many supplements are you willing to take? How many skincare products are you willing to do? And so I keep it just in my shower. It's right there. I shower twice a day. So in the morning, and that's where I typically shower most mornings here at the office because we work out and then we shower. And I keep those little travel sized versions in my bag that goes with me whenever I travel, or if I'm here, I always have it with me. And so that it's really, really easy to do. And Lorinda is right about one thing. Guys are, we try to act like we don't really care, but we're just like them. We're like, wow, that feels good. We try to act like it doesn't, but we're like, man, and she's right. The scrub just is an amazing feeling, especially when you get that Hydrafacial once a month and then you do the scrub on a daily basis. It's an amazing product. But the one thing so Zeo, a lot of our listeners probably have heard of the line Obagi. And Obagi is the most expensive skincare line that I know of. It's a very good skincare line. It's extremely expensive. And Dr. Obagi sold the skincare line years ago, and he had a no-compete. And then when the no-compete finally lifted, he created Zeo, which is what we sell. And Zeo's every bit as good as Obagi. It's just got a more affordable price point. And so I like Obagi. I like Zeo so much better just because it doesn't really shut out many of your customers, where Obagi at times would, just because of the cost. $400 or $500 can get pretty costly on some of this stuff. So anyway, and you're right. It's a cool looking packaging. It's not something that you're ashamed to have around. But the key for a guy is just start washing your face with a good product, use the scrub, have a good lotion to also apply to moisturize the skin, and then have a sunscreen. And for the most guys, now picking those can be different. That's where you need to come see our professionals, because every skin type is different. Are you oily? Are you dry? All those things matter. It's not one protocol, every person. That's why it's important to come in and let us look at you.
So we've got a comment here from Cindy. She had really good results for the 3andMe, and she's been trying to book another one for a few months now. So guess what, Lorinda?
I'll look her up and give her a call.
Well, so we did have a little bit of issue for a brief moment in time. Our Icon technician was out on maternity leave, and Lorinda wasn't quite yet licensed. And so we went through this, unfortunately, and I'm sure that's what she's alluding to. We went through this, unfortunately, and we will be reaching out to you today. Don't worry. Everybody's fully trained. We've got multiple technicians. We're ready to go. So we will make sure that young lady is properly taken care of.
We'll get you taken care of.
So when I think skincare, I think, okay, there's the lotion or the cleaner or whatever, but then there are treatments, and then there are maybe supplements or whatever. So let's go through the list of treatments that one might be able to consider if they came into the research clinic.
You want me to take that one low, or do you want
to? Go ahead. No, you can go ahead.
So, I mean, what we like to do is just get a patient in the office and just try to see what their goals are, and see what, like I always say, what's your wellness goals, what's your skincare goals. Mm-hmm. And then you do have to, as I always say, I don't care how much money you have in the bank, there's some sort of a budget as well. So if we can try to figure out what the budget is, how much you're willing to spend, then we can kind of figure out the best path for you. I always tell my patients the simplest, best path for so many people is simply a Hydrafacial every month with a good skincare regimen. Mm-hmm. And if that doesn't fix everything, then maybe a little Botox, maybe a little bit of filler. And guys, Botox and Juvederm is for women and men. So don't forget that. Guys get injected too. I've been on Botox for, I'm 73 now and you don't even know. Anyway, starting there, and then we can take it up a notch, obviously, from there, depending on what they are. Like I saw a lady earlier in the week, and she wanted a bunch of filler, but honestly, she was a little bit past filler at this moment, and that's where I recommended the 3 for Me or the Icon, which is a laser treatment to actually tighten the skin, even out the pigment, so that when we go do the filler down the road, that we're starting with a better base. And so we do the Icon, which is the 3 for Me. We do the Hydrafacials. We of course do the microchanneling. We can do it with PRP if we want to. The Hydrafacials, the injections. We pretty much do it all when it comes to the skin.
So I was, I don't know why I didn't think of it, but I was watching some videos on YouTube about intermittent fasting, and there's a common theme of how it improves your skin health as well.
So taking it back to our normal conversation, anything that improves the immune system, that detoxifies the body, because our skin many times shows what's going on inside the body. And and also hormonal imbalance. So hormonal imbalance makes the skin not as good as it was. Estrogen deficiency dramatically affects your collagen elasticity. And so ladies will notice that when they pass menopause, like, oh my God, I hit menopause and my skin just started draping like in a couple of years. It's like, yeah, it did, because you lost all your estrogen. So one of the big reasons I tell ladies to consider estrogen replacement, in addition to dementia reduction, in addition to your bones, in addition to vaginal health, is your skin and hair and nail quality is important with estrogen as well. But a proper diet, you can't eat at McDonald's all day and expect your skin to be just perfect. It's just all that crap you're putting into your body, and it affects you. It really does. So the cleaner we can eat, the more organic, the more fresh that we can eat, I think you're going to see also your skin quality improving. So intermittent fasting, which is going to be our topic next week, just a little teaser. I've already told a few patients, so I'm glad Steve agreed to it today. So I was like, man, if he doesn't agree, I've already told a bunch of people that we're going to do that. But intermittent fasting, again, it's boosting so many good things in our body, and the skin's just kind of the reward that comes along with intermittent fasting.
So, when we think about the things that we take in that do that, so the things that we don't put in, so if we go without for a while, that improves our health, improves our skin. So what are some supplements that you would recommend that we could start to consider? And then let's talk about peptides and or other things that we should consider.
Yeah, so supplements, I just think it goes back to doing a general evaluation and seeing what you really need in your body. And I think the skin will react in a positive way to what we're doing. And so that's where like the vitamin D comes in, and the vitamin K, and, and just, again, it goes back to, if your body is in proper homeostatic state, your skin's going to be the recipient of that good state. So I don't typically say, hey, let's take this for our skin, although we do A, D, and K, which vitamin A has a positive effect on the skin. One of the supplements, though, that I love for the skin that we use for a multitude of reasons, though, is the DIM that we've talked about before. Mm-hmm. And DIM is the base compound of broccoli and Brussels sprouts. We have our ladies take 1 capsule a day. We have guys take 2 capsules once a day. And in addition to us believing it's somewhat breast protective and prostate protective in men, it cuts down the unsightly hair growth for women, like under the chin, especially with hormone replacement that can sometimes happen. It cuts down on the bloating and swelling with hormone replacement in women, but it also is very skin soothing, and less acne, less breakouts, less hair growth. Because I kind of throw the hair growth in there with the skin, because it's all in the same area. It affects ladies the same way. They don't like it. So DIM would be one of those big ones to use. But the big thing is just getting in and making sure that we're all just doing the right thing, making sure we've got labs to justify what we're doing as well.
So tell us some recent new peptides that come out that are actually topical in nature, that don't just improve your skin health, but also maybe help someone like me that might be follically challenged.
Yeah, and actually me too, starting to get there. So we're really excited that with some of our recent conversations that the FDA has allowed some of these peptides to actually go over the counter, because some of these peptides we actually lost temporarily while they were being reformulated as a cosmeceutical. And so the main one, so one of the main peptides that is in 2 of these products is actually GHKCU. And GHKCU is basically a copper peptide. And copper itself is an amazing wound healer. It is an amazing peptide for actually improving hair follicle growth. And it also just helps the actual medical studies with GHKCU have shown up to a 70% improvement in collagen elasticity, and has also shown a 35% reduction in wrinkle depth. And so you can actually use this peptide now kind of, I don't recommend it as a replacement for Botox. They call it the Botox peptide. I think it's actually what Lorenda's already said, which is an augmentation with Botox if a person wants to get Botox. It basically is just prepping the skin. We have our patients use it on the face, neck, chest. Comes in a little handy-dandy little OptiClick. It's really, really simple to use. It's affordable. This was a prescription a year ago. And so I always try to impart that on my patients, that this literally was a prescription a year ago and was much more expensive than it is now, and can only be purchased through a BioT provider. And good news is we're about to go live very, very, very soon. We actually had a meeting with BioT yesterday on being able to purchase these products off our website if someone is not in our area. But one of the things Lorenda has helped us do with all of her knowledge is we now have our own little shipping center in our office, and we ship it right out to you. We don't even have to go to the shipping store anymore, which we love because we're all kind of
the big things. Big things I'm doing.
Yeah, hey, that's huge to me.
I love that product. I've really focused on using that on my neck because I'm 46 and. After 40, and I hear this from a lot of women, they see a lot of changes in their neck, the texture of their neck. Mm-hmm. So, I mean, there's only so much we can do. Just things change. But I love the results I'm seeing from using that product on my neck.
And most dermatologists, Steve, would tell you that when they look at someone, if they were going to be like the carnival guy that guesses your weight, they're going to guess your age, they're going to look at your neck, and they're going to look at your chest.
Yeah.
That's where women especially show their age, because a lot of women do a decent job of protecting their face, but they stop at their face. They forget that just like me right now, this is showing when I go outside. And it's getting sun damage and showing my age as well. And so that's why we always recommend it on the neck and chest. And you'll be surprised. And you can use back of hands as well if you wanted to. That's another place that you can show your age. And, you can get really, really good results for an affordable price. It is something that, in my opinion, needs to be part of the normal skincare regimen with the patients. And it only helps all these other procedures work better. But the gobbler, so that just brings me up another topic. So I kind of have it too a little bit. Mine's gotten better with some of the treatments. I have to admit that I get so dang busy, I don't get the treatments as often as I should, and I'm going to try to do better in 2021. A lot of people use Kybella, which is an injection that you put into this area. I will tell you, it burns like, it's like injecting gasoline into your neck. Basically just lyses the fat. I didn't find that it worked very well in my patients. I'm just being honest. I felt like the pain for what you got just wasn't really there. So we have added to our practice as well. We have the submental sculpture handpiece, which is very inexpensive. It uses heat. Sculpture is the newer technology than cool sculpting. Uses heat versus cold. It's not as painful. And you can do 2 or 3 really quick treatments there and get some fairly significant tightening and remove that little fat pad that a lot of us have as we age, but really tighten that tissue up. I know for me, that's one thing that really bothers me about myself, is just that looseness to the skin there. Yes. But anybody that would do that, though, I would also say, hey, after you do that, you need to be using Illuminate to get the ultimate results. Because what we learn is very rarely does one procedure fix the problem. You have to do other things with it. And that's life, I think. Like hormones are great, but there's more to it than just getting your hormones fixed. I always use the analogy, like, you can give me hormones and okay, now you gave me a sports car, but if I don't put the keys in it and drive it, what the hell do I have a sports car for? So I need to exercise. I need to have the nutrition. People who complain about their libido and things not coming back. I'm like, well, what are you doing to have your libido back? You got to get out, get some exercise, get the blood pumping, get the feeling better, and everything kind of comes back. And the skin's no different when it comes to that and skin procedures.
So would you use microneedling to supplement or to make it more effective, this particular peptide?
You actually could microneedle it if you wanted to. And because if you think about it, you're just getting it to go under the skin anyway, and you absolutely could microneedle GHKCU. And back when it was easier to get a hold of, that's exactly what a lot of high-end cosmetic practices did. And that's a cool thing about microneedling. As long as it's safe for the skin, you can microneedle it. You're just taking it very, very slightly under the skin. But yeah, that's actually a good thought. You actually can do that.
So let's talk about this PTDBM.
Say that 3 times, right?
That's easy for you to say.
Yeah, PTDBM. So actually, so they have a cool little container here that's actually, so the new products that are the one with a little bit of color to it, I don't know if you can even see that on there, is that's actually the copper peptide. And that one is got the name Hair Rescue Repair, which is actually mainly GHKCU, but they've also included zinc thymulin in it as well. And zinc thymulin is also kind of a cool peptide that it actually, zinc deficiency is one of the major causes of hair loss. And so with the zinc thymulin, you're getting a little bit of the zinc back into the scalp to make sure that that's not an issue. Zinc thymulin also decreases graying of hairs. So a lot of times patients will like that. And so with the Hair Rescue Repair, that is mainly used, in my opinion, for thinning of hair and mild hair loss. The one that we use for like what we call androgenic alopecia, which is where you're balding on top of the head that a lot of men go through, you want to start usually with the Hair Rescue Activate, which is the PTDBM, the one that we are making fun of the name. You can actually use these two products together, which is the ultimate. And you actually can also, this one's not over the counter, but believe it or not, the animal studies with PTDBM showed significant improvement when combined with valproic acid. Valproic acid is actually a seizure medication. We are using it topically though, so we're not taking valproic acid by mouth, so you don't have to worry about any of those side effects or anything like that. And we're certainly not treating seizures, but we can order it topically. It's not very expensive, but it is a prescription, so we can't put it over the counter. So my patients that use the PTDBM, or as we call it, Activate, we like to combine it with the valproic acid to get the ultimate, because they showed nearly a doubling of the hair growth when you by adding the valproic acid to the now you got me self-conscious. Yes, PTDBM. That's why I was like, there's no B in there.
Just call it Activate. That's
yeah, exactly. And so, but the PTDBM, along with valproic acid, does an amazing job. Now, most of my patients in my practice, I actually use the Repair most of the time. Repair is because so many of my ladies that I see complain of hair thinning and the quality of their hair as they age, but they're not necessarily balding, okay? And GHKCU, just like Illuminate, where we're using it topically on the skin, and this wouldn't be real practical to try to do it in your hair because it's a gel. You'd want the serum type product to use on your scalp. Technically, you could use this on the face if you wanted to, but we're using it on the scalp. So what was it? I had another thing. Hang on. Oh, and then we also can do, and for guys who are like, what did you call it? Hair follicle challenged?
Yes.
follicular challenged, what we'll actually do with those guys, like the most intense protocol is actually to use the PRP, draw their blood, spin it, take the PRP, re-inject it into the scalp. Sounds painful. We put a numbing gel. It's really not bad. And then we will put them on all three of the products, the valproic acid, the Activate, and the Repair, excuse me. I'm even getting the names mixed up. Rescue and Activate, Repair and Activate. Golly, I'll get it down in a second. Along with valproic acid. But we'll also start another peptide via injection, and that's the thymosin beta-4. I don't think we've heard that one in a little bit. But thymosin beta-4 is a fantastic muscular repair, but it also causes hair growth. So I will literally do the injections in their scalp. We will have already ordered the TB4 in for them at the time of the visit. They will that day start the injections on a daily basis in their stomach, not in their scalp, okay? And we'll do one injection a day for 21 days. That's how many doses are in the vial. And then they'll come back every 30 days, and and they'll be using the hair care products the whole time, never stop. And we'll do this 3 times typically. 0 days, 30 days, 60 days, repeating the TB4 each time. And you can get some amazing regeneration of hair growth. In my opinion, it's the best results that you can get out there right now. But it is important with any hair products that you make sure the patient understands that it's going to be 6 months. You can't judge it in under 6 months. Even if you do 3 rounds of the shots and everything, then I'll be like, once we finish that third one up, I'm like, in 3 to 6 months, we'll judge where we're at. Hair just takes a long time to come back. And then you'll have to go into some form of a maintenance program as well, to make sure that once that hair comes back, it's like my guys with erectile dysfunction. Once we get it back, then we got to make sure we do something to keep it. So we can't just, we're all good and truck on down the road, because there will be, it will start to creep back up on us.
So I have 2 questions. Would microneedling be applied to the scalp? And what about people maybe dealing with immune, what's it called, where your immune system is attacking your body, and then maybe lupus or something like that, where women are experiencing hair thinning?
Yeah, so you absolutely can use microneedling. Microneedling PRP into the scalp is no different than microneedling and into the face. I generally like to just go ahead and use the needle and and do it that way. It's just the way I was trained, and it's the way I prefer it. But you could do microneedling. You got to, of course, work around hair follicles and things like that. But you can, especially if you have a bald spot, you could absolutely microneedle it. As far as like hair loss from autoimmune disorders or just alopecia areata, just a bald spot. Like we have a good friend that she just has a bald spot that stress induces. A lot of people will get bald spots from stress. And the most common way it's treated was steroid injections into the area. And that will help some, but in my opinion, you're ultimately going to create a bigger problem down the road. You keep getting these steroid injections into the scalp, you're going to eventually kill those hair follicles at some point, and you're going to end up with permanent hair loss. And so that's where I think that these type products are much, much better. Any combination of it, there's a lot of skilled providers out there when it comes to hair and face. It's just making sure that because a lot of people that are going to listen to this probably aren't in our area. It's just making sure you got a quality place you're going to that really knows what they're doing. That is, we're constantly getting more education. None of us know everything. We never will. There's always something new. Every few months there's a new product, and some are great, some aren't. And we test everything on ourselves first. There's nothing that's hasn't been tested on most of us. We're our own little guinea pigs. It's kind of the negative and the positive of working here is if you work here, you got to pretty much agree that you're willing to try some different things, because we need to try it out on our friends and our employees and things like that before we release it out to the public.
Lorinda, what are you most excited about? What you're able to offer at the research clinic?
I love that we now can really focus on the aesthetic side, with the skincare. I love everything we do here because like I said before, I was a patient before I came to work here, and it is so important to me that people have the knowledge to understand why they need to be healthy and why it's important to work at it every day. I have people that are like, they'll tell me, well, some days I just don't want to do that, or I don't want to do this. And I'm like, you have to brush your teeth every day. You have to get up every day. You have to start small with little things, exercise or supplements or skincare, just doing something a little every day with your health, because we're all going to wake up someday and be 65 or 70 and think, oh my gosh, I didn't take care of myself. And some things, I have women come to me and at 35, and I have women come to me at 65, and I explain to them their skin sometimes is like a piece of paper. And if you crunch up that piece of paper so many times, I can't get it smooth and flat again. We can do lots of things, but just educating people and having, I'm learning constantly every day. It is so exciting. There's so much knowledge, and Dr. Kris is amazing on the people that he puts you in contact with for learning, and the information that we get here. We're just not stuck in the last year still learning about that. It's something new every day. And we get to share that with our patients and educate them so they have the knowledge and they can take it home and grow with us.
One thing I can promise our customers is that we're never going to be stuck in time. We're always going to be moving forward. We're always going to be changing, adapting. That's just our field of medicine and aesthetics. And that's just, you either adapt and you move forward, or you're going to get left in the dust. And so, and the other thing that I try to tell my patients is that sometimes, to my own detriment, I don't try to save money when it comes to buying equipment and, the products that we use. I feel very comfortable that you can step into our office, or you can step into a place in downtown Dallas, and you're going to not find better technology anywhere, because, that does matter. And the one thing in aesthetics that a lot of patients don't understand, especially with the social media and the everything at your fingertips, is they don't understand like why someone charges this, but you charge that. Well, that's a lot more than what they do. And they're like, well, yeah, because they're not really doing what we're doing. And, it's sometimes can get hard for patients to understand it's not apples and apples, it's apples and oranges. And that's where it's really important for us to educate our patients on what we're doing, why we're doing it, what are the outcomes. The good news is if you get results, people will understand the difference sometimes in cost. And not everything is expensive. I'm not trying to say that. But I just think it's really important that they understand that aspect of that, the fact that we're really, pushing towards making sure that we have the best things for our customers out there.
No, it's touching, especially social media. I get, people ask different questions, like on the micro-channeling, microneedling. They've seen crazy things on social media with people with blood all over their face. And I'm like, no, that's type, or, certain products. They're like, well, we see this everywhere all over Instagram, and all the bloggers say it's amazing. I'm like, because they're paid to say that. Come talk to us, come talk to professionals, at least come in and get a consult, and let's go through and see what's going on. Don't diagnose. It's like people going to WebMD or going to Instagram for their face.
Yeah, no doubt.
So, Dr. Kris, you kind of are seeing the things that are on the horizon and that's coming out soon. What are some things that you're excited about that maybe haven't been released yet?
I think it's, for me, and of course I'm a little bit, I'm a little bit jaded towards this. Or not jaded, I'm just a little bit biased, I guess is the word I'm looking for. It's just the peptides that are coming down the pike, there's some doctors that believe that peptides are going to be more regulated and they're going to be harder to get. And there's some truth to that because the FDA has gotten a little more involved, and I do personally blame Big Pharma for that. But there's a lot of great peptides in the pipeline that we're hearing about that are coming over from Europe that's been around for years that I think that they're going to make some big changes for us. I'm just excited that, I'm even excited with I'm very excited with my relationship with BioT because they're really making great strides. And I think I'm part of one of the docs that's helping them push towards that, but they're really making big changes and getting these great products out to our patients that now are affordable, that they can get a hold of. That used to, I had to order these things through the pharmacy, wait a week to get it. They were really, really expensive. Now that they can literally just walk in, we can educate them, boom, they can walk home with them. I think that's a really great thing. So, I don't know if there's any like great machine or anything coming out like that. I just think it's a really exciting time to be in the business that we are because of the changes that are coming. I know you've heard me say this. I firmly believe that, in the next 5 to 6 years, you're going to hear commercials saying, do you know what your peptides, like here we hear a testosterone commercial, every commercial break on terrestrial radio. I truly believe that one day somebody's going to say, yeah, he said that, when you're hearing peptide commercials actually on the radio and TV and that sort of thing. And it's cool to be on the front wave of, the front side of that wave. And so they just can make such a big difference in people's lives.
Yeah. It's always hear low T, but you heard it here first, low P.
Yeah, right.
Low peptides. So I'm curious, BPC 157, common peptide, that would be one that you would take and expect that it would improve your skin health?
There's actually, I haven't been able to find it lately, but BPC used to even be compounded and used topically, like either on a joint or on skin. I don't know that I think that you're right about that. I think it would help the skin. I just think that BPC has so many good characteristics. Actually, it kind of brings me up to what you were talking about a second ago. I saw a 70-year-old man right before lunch, and he looks fabulous. He's healthy. He exercises every day. He was, in a week, he's jumping in a truck and driving to Wyoming. I said, why to Wyoming in the winter? He's like, I just want to get away, and he's just healthy like that. And I said, you're everything that I want my patients to be. I want them to be 70 years old and get in a truck and just drive around America and have a good time and, still have a sexual life and that sort of thing. And he said, I went to my high school reunion a couple of years ago, and he goes, I didn't even recognize those people when I went. He goes, they're all hunched over with big guts. And he said the ladies were all like, they don't even have their shoulders up high anymore again. I go, yeah, that's because you've invested in your health. You have put an effort in since your 30s of taking care of yourself. You understand the importance of nutrition, exercise, not drinking too much. You understand, all those importance and the importance of all those things. And, just one of those things as you were talking and I was thinking about, he's a great example of someone that's done it. He didn't even realize he was doing it. He just knew that he felt better when he ate better. He knew he felt better when he didn't drink as much, that sort of thing. And it just happened naturally because he's only been seeing us for, a few years. I can't claim all the credit with him. But I put him on BPC today, though. It is the funny part about the story is he was like, he's always like, what do I need that's new? And because of COVID, he hadn't been in 6 months. And I said, man, BPC has gone over the counter. I need you on it today for aches and pains and wellness. And he is concerned about his memory. So I said, for brain function, that neural protective aspect of BPC. So anyway, BPC, great peptide.
It is an amazing peptide. I actually just started taking the over-the-counter. My pubic bone separated when I had my second daughter, which she's 15 now. So it's been a long time, but my hips kill me all the time from, working out. They're just tight. I ache and, typical thing. I'm here and my daughter, she's been on it. My husband had disc replacement surgery. He's been on it, amazing results. And I thought, maybe I should take that. And it's crazy how much better I feel from, I'm so mad at myself. Why didn't we start taking that when we first got it in? I was too worried about my face.
Yeah.
So here's the bonus question. Why are gray hairs so wiry and hard compared to the hairs that aren't?
I think it's just because you're losing the quality of the hair. When you lose the color, the pigment, most of the time they become a low quality hair basically, and that's what causes that kind of fraying and wiriness and that sort of thing. And so, and that's actually when I was talking about the hair rescue repair, it's actually got the zinc thymulin in it as well. And the zinc thymulin actually helps reduce the grayness. So this product is not only helping build back the density of the hair follicles, in other words, that hair thinning, but it also the quality of the hair as well. And I think we've been using this product for years in our practice. It just wasn't over the counter. I went 6 months without being able to get this product, and I had a lot of pissed off ladies because I couldn't get it.
You did.
And it's a great product. It used to be a foam, so it was a little bit hard to use. It was kind of like those soap products that you kind of go and it kind of creates this foamy, soapy looking thing. This is so much better with a serum because you can kind of direct the liquid a little bit better. But yeah, I mean that. Just proper hair care with these products, and typically all that stuff will improve the quality. We can't bring the color back, but that person that's starting to gray, you can actually kind of halt that possibly as well.
Yeah, I've noticed it's a trend how ladies that they struggle. I just did Bruce Willis. I just shaved it, and it's turning gray, whatever. But I noticed some ladies, they would struggle. They try to color it for a while, and then now that I've noticed a trend, and I think it's really cool, they're trending back to gray. They're embracing the gray. And I'm wondering, as you're talking there, Dr. Kris or Lorinda, maybe you would be better to ask. This particular product would be great to implement in that transition.
And aren't some young ladies like going with gray hair? Isn't that a new trend as well?
My daughter wants gray hair.
What the heck? It's like like big booties. You used to want to keep that from happening, and now the girls want big booties. And okay.
There's a technical name, and I'm racking my brain for exactly when you deplete the pigment in your hair, and I cannot, I can't remember what it is. But
yeah, it's a good product for that.
Yes.
Absolutely.
Well, good. This has been awesome. I'm glad to meet you, Lorinda, and I'm glad the folks in the area that have been watching got to meet you as well. So we should have you on more. The skincare stuff. I'm a guy, so I don't think about it so much, but it is an integral part of an overall good health system that you would implement.
Yes, when I first started coming and training here, I was actually surprised by a lot of older men that they're on skincare or they're doing certain lasers, because they didn't take care of their skin, and they're in here in their 60s and 70s. And I'm so proud of them because, they care, they don't want to look bad. And I think it's great. Everyone should want to feel great from the inside out or from the out inside, however you want to do that. But as long as you're working towards something healthy to make you feel great, I commend you for that.
I have a question, Dr. Kris. I'm sorry I'm interrupting you, but
no, you're fine.
The CJC ipamorelin as well would impact your skin tone and health as well?
Yeah, so it's just increased growth hormone levels will typically improve your skin. Thank you for actually bringing that up. That's actually a good observation. The reason I love CJC ipamorelin so much is, it kind of hits so many different things. It helps with that fat loss and muscle production. It helps us sleep better. It helps our stress levels come down. It also can help skin tone and healing. It's just an amazing peptide. And that's basically happening because of those improvement in getting more optimal growth hormone levels, because we know that our growth hormone level does decrease as we age.
Well, good. So next week, we're going to be talking about how to fast.
Different fasting techniques and just kind of the effects. As I was telling you earlier, I'm reading a great book right now, Fast This Way by Dave Osprey, about all types of fasting. And, I just think it's really an interesting topic that I never thought I could spend 45 minutes on, but I really think we can. And I think that patients might find it interesting. And I've already mentioned it, like I said, to a handful of patients because I probably honestly talk about intermittent fasting at least 2 or 3 patients a day. And, I was like, hey, just listen next week and you can get probably more than you want to hear about. But let me say this before my office manager, my wife, kills me. She wanted me to do the February specials. So if you buy Botox in 2 areas, get a 3rd area free. Basically, it's a minimum purchase of 40 units and has to be used at that visit. Also, our Juvederm products are, if you use 1 tube, it's $50 off, 2 tubes, $125 off, and 3 tubes, $250 off. And she also wanted everyone to know that Allergan is offering double points to the Alley members who purchase filler. And the ladies out there that get filler will know what I'm talking about with the point structure. So those are the specials. We'll be posting it, though, on our social media and that sort of thing. She just wanted me to let you know that we have some pretty cool Botox and filler specials this month, probably because it's Valentine's Day coming up. So that's probably a little bit of it.
And all the husbands that need to get a gift for their wife, they could just come see me.
That's right.
Just come in here and get them a gift.
Right.
And I promise you, your wife will be happy if you let her come take care of her skin.
We all need that. So we appreciate everyone listening. You've been listening to Peptides and Age Management with Dr. Kris Fusterhausen of the Research Clinic. We met Lorinda today, Van Newkirk. She's going to help you get your act together on your skin program. And then remember that all these conversations are intended as educational, and always consult your physician before changing your medical program. And if you have a physician that you think Dr. Kris could help you with, maybe help them understand peptides or prescribe those or whatever it is, Dr. Kris is always open to talking to your physician as well. So any last comments before we go?
No, I just think next week we'll be talking. It's going to be quite a bit colder than it is today. I hear next week's going to be quite chilly. So I'm sure up in your neck of the woods it's going to be even worse. Yeah.
So we'll have a pot of chili on while we talk about fasting.
Before you fast.
Right. All right. Well, we'll see you next week. Be sure to send your questions in and reach out to the Research Clinic to take advantage of those specials. And that's a wrap. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.